In my line of work exploring pharma reputation, it has almost become a cliche in the past year or two to say that the pandemic has changed how people see pharma companies. But is there evidence to support this? The public have had more exposure to the power of pharma to improve and save lives. Some pharma companies are probably now household names in a way not seen before. The sector has also been exposed to an unprecedented level of mainstream media coverage, both positive and negative. So the big question is, has all this led to a heightened degree of trust? I often hear in conversations with frustrated pharma execs that rightly or wrongly, the sector hasn't always had the best reputation for a range of historical reasons, as well as more recent examples of poor corporate behaviour. So is this still the case? If so, what can they do about it? At the moment, pharma attracts the second highest level of trust of the industries we're measuring, sitting just behind tech, but ahead of others such as banking. But the public are polarised to some extent. Over 3 in 10 people globally find the sector trustworthy, while just under 3 in 10 do not. The rest are sitting on the fence. But this current level of trust is an improvement on 2018, where just 1 in 4 felt this way. And at the same time, distrust has waned, down from over 1 in 3 in 2018 to 28% today, meaning that the sector is in positive trust territory. So behind the headlines, perceptions vary by regions, with levels of distrust and scepticism remaining high in certain countries. If you look at those populating the bottom of this chart, many of these countries' experience of COVID-19 vary greatly in terms of case numbers by population, vaccination availability, and their individual approaches to handling the pandemic. This suggests that distrust may stem from other historically deep-rooted factors. So how can we understand this better? A deeper dive into the drivers of trust in pharma holds some of the answers. On balance, the public are more likely than not to feel that pharma companies behave well in the pandemic, are good at what they do, and are increasingly reliable. And more often than not, they are seen to behave responsibly and have good intentions. This suggests that some increases in trust are due to the proof points around their motives that the sector has so far demonstrated in the pandemic. Indeed, our Ipsos-based NETS analysis shows that behaving responsibly and being reliable and keeping promises are the 2 factors with the greatest impact on overall trust in the sector. But not all companies develop vaccines, or indeed other COVID treatments. And this means that the impact of the pandemic on the sector's reputation is asymmetric. So what about its work across other myriad therapy areas? What happens when the pandemic isn't top of mind or as high profile in the news cycle? Can it maintain this increased goodwill? The challenge now is to tackle weaknesses, some of which may well be deep-seated. This trust data shows that openness and transparency polarises people, and there is less certainty as to whether the sector shares people's values. That is, whether it demonstrates a genuine sense of mutuality with patients and the public. Indeed, though an improvement on our last survey in 2018, people are still more likely than not to feel that pharma companies would take advantage of them if they could. And this is a significant point. A sense of shared value and mutuality will be important factors that underpin the way in which people trust them and therefore their willingness to support the sector, for example, consenting to the use of their health data to inform R&D. In our other work, we know that opinion around topics such as pricing, profits, and access to medicine have long been sources of controversy. There is also a tension between praise and faith in scientific endeavour, innovation, and R&D, but less certainty or indeed knowledge of the governance and the behaviour or motives of pharma companies as corporate citizens. So pharmaceutical companies could focus on shifting perceptions so people see them as value-led companies who put back into society, specifically looking at R&D and manufacturing the medicines and vaccines that are vital to help people and fundamentally improve lives. And public trust and support for pharma could then allow for useful business outcomes, such as fewer roadblocks with regulators and policymakers, greater public support for pharma's ability to make a profit and reinvest it in R&D. And we know from other work that opposition to profit making isn't as high as you might think, though certainly a reputation weak spot. The good news is that professions that are intrinsically linked to the sector, the medics and the scientists, are the most trusted professions, as you can see in our Veracity Index. Beyond the type of work they do, there is an important role for professionals like these to act as mouthpieces for the sector. There will be a role for the CEO or the C-suite in public-facing comms and, of course, professional communicators, though one to use with caution given the lack of trust in business leaders. But the delivery or validation of trust-building communications from people like these will help the industry build on recent trust increases and foster a favourable reputational climate to build on the successes of the pandemic and look to new horizons with its R&D to tackle health challenges around the world.